Good morning. I'm Dr. Zimmerman, and on behalf of Washakie County Public Health, thank you for joining us. This is a Facebook Live, so if you have questions, you can send them in, and they will read them to us. And we are a panel made up of local healthcare professionals who have volunteered our time to come answer questions from the community. And so we're going to go around and introduce ourselves so you know who is going to be answering your questions, starting at the end.
Jeremiah Cannon, a nurse practitioner from Red Rock Family Practice.
I'm Kirsten Carroll, nurse practitioner from Red Rock Family Practice.
Sarah Ann Galloway, nurse practitioner with Wild Rose Wellness.
And I'm Dr. Ed Zimmerman. I'm public health officer. I have a little hobby clinic here in town, and I'm a full-time ER doc outside of town. So the reason we wanted to bring this presentation to you today is there's always a lot of questions. I put out an almost daily update, and I get on the Facebook, and we get a lot of questions about all kinds of topics regarding the coronavirus. There's a lot of miscommunication out there as far as how dangerous this is, and so that's what I wanted to address initially. This is not the flu. For one, it's transmitted to each other much more easily than the flu is. For every one person who gets the flu, they may give it to an average of 1.3 people. So one to 1.5 other people may get it if you have the flu. This one is at least 2 to 3, and I saw a paper yesterday that's in pre-publication that as much as 5. So every one person with virus may actually infect up to 5 other people. Right now, the going rate's between 2 and 3, but it's twice as bad as the flu. And so that's concerning just because we know it'll hit more population. It'll make our curve a lot steeper. A lot of people will be sicker in a shorter period of time, making it hard for us to have the resources to care for them. The other concern, the fatality rate on this is literally 10 times worse than the flu. So nationally, the flu is 0.1%, so 1 out of 1,000 is deaths. And this is for flu virus that we've all kind of built some immunity up over the years. It's not novel or new like this virus. And so we do have a little bit of immunity naturally, and we can vaccinate, and we can actually decrease our death rate. So that's why it's at 0.1%. The current one, we believe, is around 1% for coronavirus. It's a lot worse than other countries based on their populations. You know, in Italy, it was really bad because they're all really old smokers. And so they died at a horrible rate, but around 1%. So 1 out of 100, which doesn't sound like much until you think of, a gymnasium of 500 people, at least 5 will die, or a bowl of Skittles, and 1 of those Skittles will kill you and the other 99 won't. You wouldn't want to take a Skittle out of that bowl. So 1% is still a very high rate. And if you look at the spread of ages, if you're above age 60, it goes up dramatically. And if you're over 80, it's atrocious. Catch this virus and you're over age 80, regardless of the healthcare you receive and how aggressive we are, 1 in 5 will die. And so we've never dealt with a virus that had a mortality rate of 1 in 5 in any particular age group. And so that's why we are very adamant about social distancing. When you have a pandemic, the only thing we can really do to decrease the spread is social isolation. And so the 6-foot thing that we're trying to have everyone do, the fact that some businesses have been closed and we're changed how you do go to restaurants, is all just our attempts to make sure this is not spread where a lot of people get it at one time. We know there's going to be a lot of people get it because obviously it's easy to transmit. We are worried about too many people getting it at one time and overwhelming our resources. 4 out of 5 people who get it really are not that sick, but those others will end up, and out of those, we have about 10% that may end up in ICU. And if you start doing just on a napkin, you can do the numbers. It's pretty bad as far as the number of people are going to be in the ICU. And of those, even though we're trying not to intubate people like we used to, when this all started, it still takes a lot of equipment to support these people. So anyway, I have a hobby clinic here in town that we do 1 day a week, and we're usually very busy there, but we do have a separate entrance for people who are having respiratory symptoms. And so we're evaluating them in a totally different area of the clinic, completely separate from the waiting room or the normal rooms that we would use. And that's also where we're collecting the COVID-19 samples. And so we can do those samples through our clinic, and the other clinics can too. And so pretty much all clinics in town now can test for coronavirus. We all have test kits. We have some available. We have a reasonable turnaround time. And most of us have access to other labs where state lab won't. State lab is still prioritizing if you're in the hospital, or if you're pregnant, or if you're in a nursing home. There's certain priorities, and they accept those, but they aren't really excited about doing tests for someone who just is sick and not requiring any other medical care. But the clinics can send those to other labs, and they will accept those, and we can find out and go from there. So I'm gonna let the other clinics talk about what they're doing at their clinics also, as far as treating people who might have this virus. So.
I can start looking at it. So Red Rock Family Practice is offering telehealth to anybody and everybody who wants to do that. There's a little bit of a learning curve, but we walk you through how to connect and make appointments and be seen. We are also providing testing for strep, flu, influenza, or COVID in the parking lot. We have a big sign out front that says that we are open, but please don't come in. We call and speak to you. We are very,
Yeah, and if there are certain population that we do need to be seen, we still kind of do temperatures and ask some questions out in the parking lot and then bring them in so people aren't waiting in the waiting room whether they're healthy or sick. We have a healthy side of the clinic where if we bring you into the clinic, that there are rooms that are only healthy people without fevers, shortness of breath, cough, any of the symptoms are seen. And then for some of the other people that need to be seen in the clinic, there's a sick side of we bring in whether they're healthy or not to try and prevent any kind of exposure.
we're still seeing our OB patients. We're trying to put everything that is non-emergent, which is sometimes inconvenient for people, but we're really trying to limit who is in contact with us and who we're in contact with.
We're trying to follow all the current recommendations from the CDC, from all the organizations, is what's the safest, best thing we can do for our community, for our patients in our community.
At Wild Rose Wellness, with myself, following a lot of the same stuff that my colleagues here have talked about. As a direct primary care based and cash pay practice, a lot of what I've done has been telehealth or some different modalities as well. And so that continues, still having access to telehealth, care through their portal or secure messaging. I've done some triage through the parking. Colleagues have said as well, when we in those situations where folks do need to be seen, then we've got a side entrance that I can use, and trying to keep that and everyone as healthy as possible. So just being available as often and adhering to what the current recommendations and guidelines are.
I know the other two clinics in town also are doing telehealth. I use Zoom out of my clinic, and so if you have an email address, we can send you a link and you can hook on. And I know the other two clinics also are doing some version of that. And for those I have an elderly population that often doesn't even have an email, but you can do telephone visits. Yep. They're not quite as good, but we have options for everyone. I know all the clinics have worked together to try to come up with ways of seeing everyone. And really, if it's routine care, we're probably going to kick that down the road and see them later, because in 6 weeks, this will likely look much different than it does now. Going back to some of the public health items, we are asking everyone to wear masks when you're out and about. And even though there's not great evidence behind it, the thinking is that if you are a carrier of this disease and you're not exhibiting symptoms, you can still spread it. And so by putting on a mask, you're just showing others that you're trying to protect them from you, even if you don't have any symptoms. And so it's asymptomatic carriers. And we were just talking earlier about one. People can have this and test positive and have no symptoms at all and still be spreading the disease. So we're asking everyone to put masks on while you're out in public, maintain your social distancing of 6 foot, avoid large gatherings, 10 people or less. I think the churches this weekend all did a really good job of avoiding having the groups come together again. And everyone's been working well. From when this first started to now, if you look at the stores, we aren't seeing the families all showing up at once. We aren't seeing as many of the elderly go through. And so I think Washakie County is doing a good job. I think we're doing now as far as who is being out and exposed to public. So we're ready for questions.
All right, we're going to start with our first question. I have heard the COVID tests are only 60% accurate. Is there a need for more than one test to confirm a positive case?
There isn't. So right now the Quest test is 95%. And that's the one that Roche developed. And so 95% by any means is good by our standards. So no, you do not need to be retested. If you are really early and have minimal symptoms, it could be a false negative. But in general, if you're significantly ill, and we try to wait until people are significantly ill to test them, it should be very accurate.
While awaiting a vaccine, why not begin large-scale transfusions of survivor plasma? Begin with healthcare workers, first responders, and eventually immunize the whole population. Run 24-hour clinics, and as the transfused population grows, the pool becomes huge.
You want that early though?
Yeah, you can start with it.
So we call it convalescent. plasma. So people who've recovered from the disease have developed antibodies, we hope, and we take that plasma and we give it to people who are still fighting the disease, hoping that the antibody will help them. And they've tried it in some people and it seemed to help, but there just hasn't been enough studies to actually recommend it. Plus, just like when blood transfusions, you get reactions, you can do it with plasma also. There's a lot of proteins in there that the body can reject. And so it's not a benign procedure in general. And so until we have good evidence to show that it's actually effective and that the risks of the side effects is not worse than the actual treatment, then that probably will not be. It's a possibility. It's just not here yet. So, yeah, much it.
Do you recommend people wearing gloves? If so, where and when?
Yeah, if they're going to be having to be in contact with people, we obviously recommend isolating and not being in contact with people as much as possible. But yes, if you have to be outside in contact and you're going to be touching a bunch of things, we recommend good hygiene. So washing your hands, whether they're wearing gloves or not, washing your hands. If you have to come in contact with anybody who you think has this or is sick, then definitely we recommend wearing gloves.
It does defeat the purpose if you wear gloves and say you go to the grocery store or somewhere and then you touch your phone and then you put your phone back and then you touch your other produce cart. You're not keeping that distance of cleanliness because now you've touched something that could be contaminated and transferring that back to yourself or to others. So if you are wearing gloves, make sure you're wearing and using them appropriately, which would be to not touch everything under the sun. It doesn't give you a superhero cape for that. So just be mindful.
And if you notice, those of us in healthcare, we do not wear gloves when we go to the grocery store. We just don't touch our face.
Yeah.
And we do our thing, get all our groceries, go out, wash our hands or wipe them down on the way out. And don't touch our face, because that's really where you're going to get most of your transmission. So,
Do you know where people can find or purchase masks if they do not have or cannot make their own?
Like cloth
You can
masks?
buy them. You can.
Etsy, I've seen some. I know if people are on social media, getting into some of those community groups, there's lots of folks that have been putting out there that they're making some or donating some. So I would, kind of source your local folks first, but looking for that. And, internet's a great source on how to get patterns or, maybe it's trading, I'll buy the fabric or something like that. So I think reaching out to your community members or other kind of like Etsy type platforms where people are making goods.
I think on the Wyoming Public Health page, there's a Woodland Cares, or is that a Facebook link, and you might be able to reach out on there. There might be people that can make it or help get some of those too.
Will the incident management team ever consider looking at stricter stay-at-home guidelines, or will they follow the lead of the governor?
we'll follow the lead of the governor. It would be to expect a community like ours to make it stricter. I know y'all have heard about, like Casper was thinking about doing a stay at home in Cheyenne. It's a denser population. I can't imagine us getting to that in Washakie County unless the governor does something statewide. So.
Do you feel most Washakie County residents are adhering to the orders and guidelines set by the governor and state health officer?
I think we're doing better than some other counties. I went to Blair's yesterday, and we always send one person from our family and with the list to get it done. And I still saw some aren't there. And so it's not 100%, but compared to where we were just a couple of weeks ago, where I'd go and there'd be huge, the whole family would be there and there'd be a huge influx of the elderly. We've made great improvement. So overall, I think we're doing pretty good. I've been in some other counties, primarily like Walmart, Riverton. They were not doing as well. So I think we're doing good.
To build off of that, if there was an area of concern regarding people abiding by the guidelines, where would that be?
I'm going to start abiding or not abiding?
Abiding. That's the question. A concern abiding.
I still think there's people that are going out every day to the grocery store, and we want people to go only when they need to. We want them to get their things and then go home. I have talked to people that they go to the store every day. I think that's kind of they think they're safe because they're keeping their social distance, but the less contact that people have, the better off that they're going to be.
We don't have very many stores, but Baumgar's, Ace, those are other places too. That's where the people in Moreland do congregate, and those are still risky. locations.
That perusing and, shopping versus actually going to get what you need. I think perhaps a little bit of a shift in that mindset of make your list and then go and not necessarily just look to look.
How soon from when you send off a test are you getting results back?
We are at Red Rock, you guys can speak to this again, we're within 3 to 5 days we are receiving pretty
So if
consistently.
it is high risk to the state lab, it's 24 hours right now.
Oh,
So if I send a hospitalized person or a pregnant person, something like it, it's back really quick. But the most of us using Quest or LabCorp or somebody else, and they're that 3 to 5. I sent one last Friday, it came back on Wednesday. So yeah, it'll be 4 working days probably.
Sometimes it depends on how fast we can get it there too, through the mail. So like this weekend when the weather
It's
was
snowing.
bad.
yeah.
So, and it depends on when that test comes in, if it actually makes it out on FedEx or if it makes it. So sometimes the lab is actually a 24-hour turnaround, but getting to the lab can take a day or two from when you're actually tested, so.
My research indicates the COVID-19 restrictions cease on April 30th. As a pastor, I need to know if this is true or not. If not, what will the restrictions be and how can we move forward as a church? Are there guidelines for when we come back together? I am accountable to my church. Your answers to these questions will help me be compliant and consistent to the guidelines.
Yeah, that was extended by yesterday. Yeah. So yes, it's to May 30th. It's to the end of May now. So
It is.
yes, it has been extended. So I mean, it's going to be, and if they haven't put the official thing out, I know that it's going to be, but
Okay, yeah,
it's.
they haven't
it's-
put it out officially because I was
Well,
researching it last
yeah,
week,
it's, that's going to be the next, it will basically plan on being through the end of May because we know that our peak is going to be early May supposedly. And if you just look at the number of weeks it took to get up to that peak, and as it comes back down, they're going to keep extending this. So plan through the end of May, and it may actually go longer. So just plan ahead because don't be making plans thinking it's going to end of April. We know it's not going to end April 30th. There's just no chance when it hasn't peaked yet that they're going to go back to our standard. So.
And even when we come back to the standard, I don't think it's gonna be a May 30th, it's free for all. That everything goes back to complete normal and you're gonna be able to have churches and games and large gatherings. It's still going to be a slow, and we don't know what that's gonna look like yet. We're gonna have to see how people who are peaking earlier, they've had, some resurgence when they start opening things up. So we don't want that as well, so.
Can my kids play at the park?
No,
Kids touch surfaces, don't wash their hands, touch their faces, bring it home, touch other surfaces, and so it's not a good idea.
And I've seen the
Walks,
playground
bicycle
equipment
rides,
is roped off in most of the parks as well, so.
and the metal, 72 hours on metal, that virus is just sitting there. So the cold is not hurting it. We aren't getting hot enough to hurt it. So 72 hours, we don't want anyone touching it, so.
Is it okay to go for a walk outside with a group of friends?
How big's the group of friends? How close
Exactly.
are you?
Yeah.
Are these people that you're
Together.
yeah, people you don't usually see
Yeah,
even
and you
know.
don't know if they've been in contact with other people, so I would say no if it's not immediate family. Definitely okay to go out and walk with your family, but not in just a group of friends that.
Yeah.
It's hard to maintain 6 feet of distance on a walk
Yeah.
with friends, and so inherently you would clump, and it wouldn't be good.
And I have kids and it's difficult for them and they want to have friends over, they want to go play basketball and they want to be outside, be active, which we always tell them to do, but right now they have to be outside and be active alone or with their siblings.
I know state parks there was some advertisement over the weekend in some of my travels that the state parks are open for day use only. So, it's not that you have to stay isolated if you are not in a quarantine situation. So be active. Bodies are made to move, but we need to do it safely and appropriately.
How are medical supplies for our first responders, healthcare providers, and hospitals?
We have the basics required right now. We did get some more release from the state, and so I'm sure my public health nurse knows more about this than I do, but right now we have basic supplies. It's just when we start seeing more patients and they start burning through the masks and the gowns, it will become a little more urgent trying to find more sources. I work at a hospital, a couple different hospitals in the state, and they are really low in the hospitals that I've been at. The masks we use for aerosolizing procedures, so we have like one mask that we're issued that has to last a week. And so we put another mask over that to protect it, so if we don't get any spatter on it, and that way that one underneath mask will still last a week. Same for gowns. We can't use a gown with every patient. We're given a gown that we'll use for multiple patients. And then, so I know other hospitals are struggling. I don't know about our local hospital.
My grandpa's birthday is next week. Can we have a family get together if we stay outside and 6 feet apart?
No. You can do a Zoom get together and all be in your homes and get together use electronics, use the new things that we have, but no, I would not advise getting together.
It's very difficult to stay apart from one another, especially if you're family and you love each other. But to protect Grandpa, who is at the largest risk, as Dr. Zimmerman mentioned, it is a birthday present to him to keep away at this stage.
Should we just isolate the elderly and get everyone else back to work?
It's not that easy, unfortunately. So obviously the elderly have every right to do what everyone else does. And it's just because the mortality rate's so higher above age 60 doesn't mean that it's not going to hit those who are younger. And there's a news article about like a 6-week-old. I don't know the details, but we know that some children get it, and a lot of people are immunocompromised. And there are people in their 40s who get this or ending up on the ventilator. So we're still putting a lot of people at risk. So we cannot just isolate the elderly. So.
Do we have to worry about mail and packaging?
So currently the mail carriers, of course, wear gloves because they don't want to catch anything from what they pick up out of the mailboxes themselves. But on paper, generally we're good at it. The cardboard was a little longer, but cardboard was less than 24 hours. And so a lot of people really are, when they collect their mail, they're doing it with gloves and they're just letting it sit for a day before they open it. And that seems reasonable. Science is behind that. But and same for the schools when they get papers turned back into them, they're just letting them